Today we're going to do a non-surgical correction to our client's nose. She desired PDO threads and contouring with filler. The first step is, after cleaning and preparing the client appropriately, including getting consent, we started by inserting a series of threads over the nasal bridge in the area that was demarcated previously and open carefully with our needle. We introduced the threads one by one in succession into the nasal bridge. As we insert threads, we carefully check position to ensure that the threads are being placed carefully and precisely in the area desired. When placing PDO threads over the nasal bridge, we are hoping to provide a nice contouring and lift to the area. I like to do my threads one at a time, and after each thread is placed, have the client look at the nose to ensure that we are going in the direction that they desire. PDO threads placed in the nose are thicker than some of the other threads that we use. Therefore, it is important to ensure that your client is satisfied as you go through the procedure. Having them actively participate helps to ensure that they get the desired outcome. We also measure the columella by ensuring the thread is the appropriate size before inserting it down the center. This helps to raise the nasal tip up to a desired point and will further set a baseline for additional contouring that will need to be done once the nasal tip is at the desired level and we have built up the client's bridge adequately to their satisfaction. We continue to place additional threads after checking our current job to ensure that more is not needed. However, in this case, we decided, after looking at the nose, to add an additional thread. Again, we insert the threads through the pilot hole that was previously created, carefully over the nasal bridge to get it to the desired level. Now that the bridge and the nasal tip have been built up the way that the client and I have both decided is adequate, it is time to provide additional contouring with filler. As you inject filler into the nasal bridge, you must be careful in terms of where you inject and how much. It is imperative to constantly check via aspiration to ensure that you are not in a vessel, and to stay midline down the nasal bridge, placing very small quantities of filler as you go along. Once you place filler, it is also key to constantly mold the filler into place, being careful not to inject too much into the nasal region, as it can always cause some level of compression over a vessel that you may not anticipate, and to decrease swelling beyond control of the desired result that may leave the nose looking more bulky than when you started. It is important to note that there will be some swelling that will happen and persist for 1 to 2 weeks, maybe even longer depending on the client once the procedure is done. However, careful attention must be taken into account in terms of the shape of the nose and a quantity of filler that is placed at all times to ensure that overcorrection is not done. By taking your time to inject the filler, constantly checking for aspiration and contouring effect, your results overall will be more consistent. There is no need to rush this procedure, as it does take some time and a level of experience to get it to where you and your client are both satisfied with the outcome. Once you've finished with the nasal bridge, you can also inject into the tip carefully after checking for position via aspiration to ensure that you're not in any vessels. Carefully inject a small quantity into the tip, and for our client, it was to help to create a better symmetrical outcome as her nasal tip had some asymmetry prior to us starting. Once we checked after our first series of filler injection, additional contouring was desired and needed in order to complete the total look. Again, by slowly injecting small quantities into the nasal bridge, you're able to achieve the result. I personally believe that staying under 0.5 cc's of filler into the nose is adequate enough to get the desired effect that one is looking for. Therefore, being strategic in your placement is important. I like to keep my position about 45 degrees in terms of the angle when I inject filler into the nose, and ensure that I touch bone so that I can have more of a periosteal injection when over the bridge. I added additional filler into the tip very carefully after, again, checking for placement of my needle and providing additional contouring and symmetry to my client's nose. The client's nose was also anesthetized with lidocaine prior to me starting, and this helps to make the procedure comfortable and easy for the client to endure. Also know that the filler itself has additional lidocaine contained in the product, so additional numbing will occur during the course of the procedure. Again, adding a little more filler to the upper part of the nasal bridge region to round out symmetry and to ensure that the client has a clean line down the center of her nasal bridge helps to achieve the proper correction. The nose is very vascular, and during this procedure, bleeding is expected, as well as instant swelling. So take your time as you're injecting slowly into the areas discussed in order to ensure that the outcome is favorable. Constantly check your position and the look of the nose to ensure the proper outcome. This is before we started and after. Before and after. Swelling will persist for about 1 to 2 weeks, and have your clients follow up at a 2-week appointment to ensure all is well and they are satisfied with the results. Thank you for watching.